Phenylketonuria, or PKU, is a rare inherited disorder in which an amino acid called phenylalanine is built up in the body. People who have PKU follow a strict diet that limits the amount of phenylalanine they consume. Without the specialized diet and treatment, PKU can cause serious health problems.
The chromosome affected by PKU is chromosome number 12. PKU is a deletion mutation.
The symptoms of PKU are a musty odor in the breath or skin caused by too much phenylalanine in the body, neurological problems such as seizures, skin rashes, fair skin and blue eyes because phenylalanine can't transform into melanin, hyperactivity, intellectual disability, behavior, emotional and social problems, and psychiatric disorders.
The genetic cause of PKU is a defective X chromosome. It is a recessive disease. The only way for a child to get it is if both parents are a carrier or if one of them has it.
After babies are born, they have to take a blood test to see if they have PKU or any other diseases. If you have a history of PKU in your family, a doctor may be able to identify it through a blood test.
The main treatment used for PKU is a special diet limiting how much phenylalanine is consumed. However, infants with PKU can still be fed by breast milk, but must also ingest the formula known as Lefonic. Once the baby is old enough to eat real foods, they must avoid high-protein foods. In PKU, the PAH gene is the one that is mutated. Both copies of the PAH gene must be mutated for the condition to show. The PAH gene turns phenylalanine into tyrosinase, another amino acid. This defect can cause a buildup of phenylalanine in the body.
PKU barely affects the victim's lifespan with or without treatment. Newborn screening is required all throughout the United States, and PKU is usually identified by this method. Also, a child's outlook is very good when following the PKU diet. There is no current cure for PKU. However, the temporary treatment is a dietary restriction towards PHE. 1 out of every 10,000 to 20,000 newborns, depending on the country, have PKU. However, classic PKU symptoms are rarely seen because of newborn screening tests for the disease. PKU does not have a gender-specific rate of inheritance. PKU is inherited in an autosomal recessive pattern. This means that a person has 2 copies of the gene that is altered.